you go.
We wouldn't be where we are right now if it weren't for our care team. They're just amazing people. Oliver was born with esophageal atresia. That means that his esophagus wasn't attached at birth, and so he had surgery on day 1 of life to attach his esophagus. At my 20-week anatomy scan, they were somehow able to find out that his esophagus was not attached just by looking at his stomach throughout the scan. We transferred to Rocky Mountain Children's because we knew we needed to be in the level 4 NICU and have a surgeon for care. The delivery was kind of scary. I was in the middle of getting a amniotic reduction, and all of a sudden there was 10 people in the room, and they said his heart rate is dropping, so we're gonna have to do an emergency C-section. He was born at 34 weeks. He was in the NICU for 28 days. We were home for, I wanna say, about 3 weeks, and he stopped breathing at home. I had to do CPR on him.
Oliver was born with an abnormal connection between his windpipe, which is known as the trachea, and then his esophagus, which is the swallowing tube. And so Oliver has really struggled with recovery from illness, but even when he's not acutely ill with a cold or a infection.
We've been hospitalized 7 times for about a week each time.
I was one of the nurses on staff his first admission to our floor. You have those patients and those families that you just kind of click with right off the bat, and they were definitely one of those families. He has this like light up the room smile. It just warms your heart. It's really, really cool to have a kiddo that also trusts you and who just likes to be around you. And I can say that for him with so many of the nurses on our floor too. It's a super special bond. Ollie celebrated his first birthday in the hospital. We decorated his door, we brought some cupcakes in and just had a blast for him.
I've been so very lucky with all the support that we've had. There was a time where we were really struggling with getting bills paid, and I was worried about what was going on at home so much that I couldn't really focus on what was going on here.
They needed their water paid, so it wasn't going to get shut off. She was so upset because they were here. She had no resources. Everything was a struggle. When I let her know that the water bill was going to be paid in full, she cried in my office.
Just having that one bill and not having to worry about if that was going to get shut off at home for my kids was just the biggest relief. I could finally breathe. I could focus on my son. I could focus on myself. And I didn't have to worry about if something was going to go wrong for my kids at home.
It's times like that that you see the good work that the foundation provides for families. They are our biggest advocate and help to provide support to families that are going through some of the most traumatic times of their life.
I am an outpatient social worker. I often like to describe my role as addressing barriers to kiddos receiving the care that they need. My job would be a lot harder without Rocky Mountain Children's Health Foundation. They are a wonderful foundation that I think serves a lot of families in terms of getting support.
That has ripple effects in our community, not only with this one patient or a single patient's care, but then as we go forward, caring for an entire community of families and patients.
When I found out that I was one of the recipients, I was close to tears. It makes everything that you do, everything that you go through, not just with Ollie, but every kiddo, it makes it worth it.
I really appreciate it because sometimes we can get so focused on our duties or our job or this one patient or this big roster of kids who need to get in. And when you can take time to step back and reflect on how you can really help someone or help a family or help a patient, that really feels great. I think it serves as additional motivation to keep doing the hard work and the diligence that I do put forth in caring for children and their families. It really feels validating.
This team is so worthy of the Cradling Hearts Award because they have gone above and beyond what their job titles are. They really want what's best for you and for your family. I feel like there's more of a village behind us.